Hi, I'm Karen Kaiser. Today, the hygienist plays an ever-increasing role in patient care. As a practice facilitator, a patient educator, and increasingly a diagnostic adjunct, the hygienist finds him or herself spending more time with the patient, educating, consulting, and presenting new and improved treatments. With the introduction of the DIAGNodent, the hygienist is empowered to enhance the education of the patient, production, performance, and image of the practice, and to increase our own prestige and value. The DIAGNodent brings a new level of diagnostic sophistication to the practice. After a short learning curve, the dentist, and in our office, the hygienist, can perform a full mouth laser examination in minutes. In our office, I use the DIAGNodent Classic. The instrument is very lightweight and portable. I prefer to have it placed so that the display is in the patient's line of sight. And in fact, some practitioners have the patient hold the unit after a quick explanation of the values. Once the patient understands the procedure, the visual readout and audio signal makes the patient an active participant in his or her own examination process. I also have colleagues who use the DIAGNodent pen in their offices. They explain the procedure and values to the patient, and when the tone alerts them to a higher reading, the hygienist and patient look at the peak values on the screen together. Once again, having the patient actively participating in his or her own examination process. Meanwhile, here's how I explain the operation and benefits of the DIAGNodent to our patients. Okay, Mike, today what we're going to do for you is we're going to use our new laser diagnostic device. It's called a DIAGNodent. And what we're going to use is we're going to take this device and go through each one of your grooves and your pits and your fissures in your mouth. And what we're going to do is we're going to look for some hidden decay. And if there's any areas that I'm concerned about from the unit's emission of the audible sound that you can also watch, if there's any problems with that, I'll go ahead and I will tell my doctor about it today. First, teeth are thoroughly cleaned to remove all organic debris which may interfere with the laser illumination. Patients who are prone to heavy staining, such as smokers and coffee drinkers, should have all pits and grooves treated with an air polisher, such as the ProfiFlex 3. Then rinse thoroughly. This will ensure complete cleaning in the depths of the grooves and assure consistent readings. Although topical fluoride preparations do not usually affect the accuracy of the DIAGNodent, it is difficult to predict how some products may behave when illuminated by the DIAGNodent. The DIAGNodent Classic comes with 4 A tips used for pit and fissure areas. A flat B tip is available for smooth surfaces. The DIAGNodent pen comes with 4 occlusal tips for pit and fissure areas. The DIAGNodent must be calibrated before each patient with the desired tip in place. For the DIAGNodent Classic, hold the tip in the air, press the cal button and release. When the tone starts, gently place the probe tip on the center of the calibration disc. When the audible tone stops, the calibration sequence is complete and the unit is ready to use. For the DIAGNodent pen, hold the tip in the air and press the menu button, immediately followed by the enter button. When the tone starts, gently place the probe tip on the center of the calibration disc. When the audible tone stops, the calibration sequence is complete and the unit is ready to use. Establish a zero baseline for each patient. Because people have different levels of naturally occurring fluorescence in their healthy teeth, a baseline must be set for each patient. This is particularly important when suspect tooth sites are re-examined at various time intervals. Prior to scanning tooth surfaces, select one anatomical reference point on a tooth surface which is apparently healthy. The middle third facial surface of a non-restored tooth is ideal. Once the baseline is established, it will stay saved for that patient even if the unit automatically turns off. The anatomical location where the baseline is established should be documented in the patient's dental record for future reference. It makes sense to use the same baseline location for each patient. If that location cannot be used on that particular patient, then the deviation should be recorded in the chart. Scan the tooth surfaces with a light contact while monitoring the audible signal. Listen for an increase in tone pitch, which alerts you to observe the display to pinpoint the exact site on the tooth surface that corresponds to the elevated values. In fissure areas, the tip should be slowly rocked in a pendulous motion to carefully gather data from each pit and groove at various angles. Do not apply too much pressure on the delicate laser tip, but do make contact with the tooth structure. Two values are indicated on the DIAGNodent: moment and peak. The moment display indicates the real-time value the probe is measuring. This value changes as the probe tip moves. The peak display captures the maximum value measured in a sequence. Significant peak values and their respective locations should be recorded in the patient's chart to compare with future exams and to verify actions to third-party carriers. Research indicates the following correlation to caries: 0 to 10, no active carious lesions; 11 to 20, outer half enamel caries; 21 to 30, inner half enamel caries; 30 and above, dentin caries. Peak readings are reset to 0 with a simple squeeze of the rubber ring on the handpiece to prepare for examination of the next area. Clinical research studies show these findings to be accurate in detecting over 90% of all hidden decay. However, some decay may be too small or too deep for even the DIAGNodent to detect. With DIAGNodent, a trained hygienist can perform accurate pre-diagnostic screenings quickly and with confidence. DIAGNodent allows the hygienist to educate the patient in the latest technology, demonstrate proficiency, and provide crucial and highly accurate information to the dentist. Dr. Blaze, while I was scanning the teeth today, up on number 3, I had an elevated reading, and I'd like to know if you could examine that for him today.
Okay, will do. Let's take a look at that, Ken, see what we got. Oh my goodness, that's quite an elevated reading on that tooth, Ken. We really need to do something about that one.
DIAGNodent provides accurate, objective, quantifiable data. You'll feel good knowing you are providing the best possible care for your patients. I hope this short introduction helps you understand the full potential of the DIAGNodent. It has truly changed our practice for the better, and I'm sure DIAGNodent will be a welcome addition to your office too.